We're going to talk about today is retinal detachment. So that basically is the separation of the retina from the underlying epithelial. So the vitreous humor, this backs up behind the retina and it pushes the retina away from the back of the eye and causes detachment. So what is the vitreous humor? Vitreous is basically a clear light fluid substance that is located in the eyes, which helps the eye keeps its shape. So this is my little laser right here, and this is a normal one, and you can see how here that the retina basically just came, it separated from the epithelium layer right there. All right. All right, so what are some signs and symptoms of retinal detachment? Floaters in the field of your vision, your patient will complain of. They may see flashes of light. They may see a dark curtain or a veil moving over their vision, or they may have blurred vision. So definitely know the different signs and symptoms with retinal detachment, open angle glaucoma, closed angle glaucoma, right? Because your patient you're not the nurse to diagnose, right? That's the doctor's job. But you can get an idea and you can even recommend to your doctor, oh, that patient says she feel like she says she sees a dark curtain going over her vision. I think that's retinal detachment. I think she has signs of retinal detachment. So those are things that you want to just be aware of your signs and symptoms so you can be able to recognize it in case the doctor missed it. You can bring it to his or her attention, right? All right, so the final slide is what are some risk factors of retinal detachment? So it is associated with aging, injury, if they have a family history of it, if they had previous intraocular surgery, or if they have a ocular tumor, right? So basically pressure in that area. How is it treated? Emergency surgery is needed, right, to attach it back.